In Israel, it has been suggested that up to a third of the country's almost 10 million people could contract the Omicron variant of COVID-19 in the next 3 weeks. Our correspondent Jody Cohen spoke with Professor Jonathan Kershoni, who works at the School of Molecular Cell Biology and Biotechnology at the Tel Aviv University.
Professor Gershoni, you've been studying coronaviruses for coming up to 2 decades now. What can you tell us about the Omicron variant? And for most people, will they feel like they have the common cold or the flu?
Well, as you know, there are 7 different coronaviruses. Some of them are more virulent and cause serious disease, and some are like the common cold. Omicron seems to be a less virulent version of SARS coronavirus 2, which unfortunately has already caused more than 5 million deaths and almost 300 million cases. So this is not the common cold, but it isn't as virulent and as dangerous as the recent Delta variant that we've had to deal with.
And what's behind the idea that's being considered of testing for COVID-19 only people who are over 60 and symptomatic?
Well, I think that we're confronted with a very serious challenge. The Omicron variant is highly infectious. There are many, many people who are getting infected, and in combination with actually the optimistic development, and that is the development of new drugs, we have to know which populations are most in need of treatment. And so the drugs should be given to people who have been diagnosed early and who are also most sensitive and in danger, and that's the older community.
Israel has now approved a 4th shot, but Omicron has been described as possibly the vaccine that we've all been waiting for. Is Omicron in fact a New Year's blessing, and do you think it will bring herd immunity?
Well, this is obviously a complicated question. Herd immunity is something that we would like to achieve, but not through infection, but rather through vaccination. We have to realize that the idea of a live attenuated vaccine, such as measles, mumps, and rubella, is a good development, but Omicron is not a live attenuated vaccine. Omicron is a less virulent variant of COVID-19 causing virus. It's a disease. And although it is not as dangerous as Delta, it's highly transmissible. So there's going to be a balance of ever-increasing numbers of cases, and the percentage of those who are in the hospital is going to be less compared to Delta. But those who are in the hospital can deteriorate and die, and you do not want a, as you said, in quotes, a blessing vaccine. Possibly in the future there will be better vaccines, but right now Omicron is a disease.
WION now available in your country. Download the app now. Get all the news on the move.